Hello, I'm Dr. Nicholas Cohen, and I'm here to share with you a top 10 list of tips for genital warts. Tip number 1 is knowing how to identify genital warts. Genital warts can also occur around the anus, and the scientific name for them are Condyloma acuminata. They are the most common sexually transmitted infection in the United States, and they are caused by the human papillomavirus, or HPV, and the most common subtypes are 6 and 11, causing anogenital warts. You'll notice that they cause usually either a pink or a flesh-colored bump in the genital area or around the anus, and they can either be flat and smooth or they can be rough in texture. They can cause itching, bleeding, burning, tenderness, and in women they can cause vaginal discharge, and they can also cause pain. They can also be asymptomatic, not causing any symptoms at all. So tip number 1 is identifying genital warts. Tip number 2 is going to your doctor. If you have a lesion in your genital area or your anus, it's important to see a doctor to have it evaluated. If your doctor is unsure of the diagnosis, then he or she may send a biopsy for further analysis. Also, if you are confirmed to have HPV, your doctor may suggest that you get an HIV test, as if you have one sexually transmitted infection, you have risks of others, and people with HIV are more likely to get warts. However, in the majority of people with warts, they do not have HIV. Also, if you're female, your doctor may offer you a pregnancy test, because some of the treatments should not be given to pregnant women. In general, if your warts are less than 1 centimeter in size, if each of them is less than 1 centimeter in size, then they can be treated medically, and the first treatment can be given in your doctor's office. If they are greater than 1 centimeter, it's likely that medical treatment will not be successful, and that you should be referred to a surgeon or a gynecologist to have them removed surgically. So tip number 1 was identifying genital warts. Tip number 2 is seeing your doctor to confirm the diagnosis and to take the first step towards treatment. I'll discuss the different treatment options later. Tip number 3, to prevent genital warts, it's important to limit the number of sexual partners that you have. This is the single most important thing to do in preventing genital warts. Limit the number of sexual partners. It's best to only have one sexual partner. And this is not only to prevent HPV, but to prevent all sorts of sexually transmitted infections. Tip number 4 is consistent condom use. So tip number 3 was a very important step for preventing HPV or warts, which is limiting your sexual partners. And tip number 4 is always wearing a condom when you have sex, or even oral sex. So although condoms do protect against warts that are underneath the condom, they do not prevent against warts that can be on the outside of the area protected by the condom. So this is not an 100% effective way of preventing warts, but it is effective to a certain degree. So tip number 3 and 4 were tips to prevent warts. Tip number 5 is another tip to prevent warts. It's called the Gardasil vaccine, or HPV vaccine. It prevents HPV 6 and 11, which are the two most common, which account for 90% of genital warts. As a bonus, this vaccine also prevents infection with the two most common types of HPV that cause cervical cancer. That's 18 and 21. So you're getting double protection, both protection against cervical warts and protection against cervical cancer with the Gardasil vaccine. The Gardasil vaccine it used to be only recommended in women, and it's now recommended in men as well. And the age range to get this 3-part vaccine is between age 9 and 26. correction, the Gardasil vaccine prevents infection with 16 and 18. I said 18 and 21, but it's the subtypes 16 and 18 that are responsible for cervical cancer. So the HPV vaccine prevents infection with 6, 11, 16, and 18 subtypes of HPV. 6 and 11 are the most common causes of warts. 16 and 18 are the most common causes of cervical cancer. So we've discussed so far how to identify warts, that you should see your doctor to have the formal diagnosis and the start of treatment. And then I've given you 3 tips for preventing warts. The remaining tips are treatment. So in general, warts will go away in about 1 to 2 years on their own without doing anything. So you don't have to get them treated. But if they're causing you bothersome symptoms or you don't like the sight of them, then you can get them treated. So tip number 6 is the first option for treatment. It's called Podophyllin, and the brand and the form that you take home with you is Podophyllix. So Podophyllin is what your doctor uses. Podophyllix is the prescription you would take home with you. So importantly, this treatment is not okay if you're pregnant, and it shouldn't go in the inside of your vagina or the inside of your rectum, because it's not good to be absorbed into your bloodstream. So it's important to use this only if you're sure you're not pregnant, and only if it's on the outside of your body. So it's a 25% solution. It would be applied by your doctor at your initial visit, and then you can get a prescription to apply it yourself. Once it's applied to the warts, it's allowed to dry, and then it's washed off within 6 hours. It should be applied twice daily, but no more than a half a milliliter should be applied total over the day. And it should be applied for 3 days, so twice a day for 3 days, and then a rest period for 4 days. And then you can repeat this cycle for up to 4 times. So that's the first option, Podophyllin or Podophyllix, which is the brand for the home treatment. Tip number 7 treatment is Trichloroacetic Acid. So this is a better option, or this is a safe option if you're pregnant or if the lesions are inside your vagina or inside your rectum. It's safe both in pregnancy and it doesn't get absorbed into your bloodstream. This can be applied by your doctor in the office, and it's good to have like Vaseline or some sort of a barrier ointment around the wart to prevent it from being touched by the skin, because it can burn. And it can be applied weekly. Usually it will take 4 to 6 weeks or you can just apply it until the lesions have cleared. So the 2 treatments I've discussed so far are Podophyllin or Podophyllix, and then trichloroacetic acid. Tip number 8 treatment is Emiquon Mod. Emiquon Mod also is not okay for internal use, and it's not okay for pregnancy. So the only one that I've said so far that's safe in pregnancy and internal use is trichloroacetic acid. Emiquon Mod is a cream that's in a 5% solution, applied once daily at bedtime, and it's used 3 times a week and can be used for up to 16 weeks. The area should be washed with soap and water 6 to 10 hours after application, so when you wake up the next day, basically. So in tips number 6 through 8, I've discussed medical treatments. Tip number 9 is a topical physical mechanical treatment. It's cryotherapy. So cryotherapy, I don't recommend it. It's nitrous oxide or liquid nitrogen spray. It is safe in pregnancy, and it is repeated every 1 to 2 weeks. But it is very painful when applied. It can cause blistering and ulceration, and then it can cause the skin to be hypopigmented or a lighter color after treatment. So because of these side effects, I recommend that you try one of the above 3 medical treatments, at least with 4 applications. So I recommend you try the trichloroacetic acid, the Podophyllin, Podophyllix, or the Emiquon Mod at least 4 times before you try cryotherapy, because of these irritating side effects. But if you do try cryotherapy, it is effective, and again should be repeated every 1 to 2 weeks. So I've covered in tip number 1, identifying warts. Tip number 2, seeing a doctor. Tip number 3, 4, and 5 were prevention, which is limiting your sexual partners, using condoms, and getting the Gardasil vaccine. Tip number 6, 7, 8, and 9 were your treatment options. And tip number 10 is to believe in yourself. HPV is the most common sexually transmitted disease in the US, and I've discussed some effective treatment options for dealing with the symptoms associated with genital warts. I hope these tips have been helpful. Thank you very much for listening, and have a great day.